Hi guys, in this video we are going to see about newborn assessment. So newborn assessment is very important in newborn care. Immediately after the birth, it is very necessary to check whether the newborn is normal and whether the newborn is free from anomalies and so on. So further no delay, let's go inside the topic. Definition of newborn. A healthy newborn is the one who is born at term between 38 weeks and 42 weeks, should have an average birth weight for the country, usually between 2,500 grams to 2,700 grams, with a mean of 2,900 grams. Cries immediately following birth, establishes independent rhythmic respiration and quickly adapts to the changed environment. So a healthy newborn is the one who is born at term between 38 weeks and 42 weeks of gestation. And the baby should have an average birth weight between 2.5 to 2.7 grams. And the baby should rise immediately after birth, and the baby should establishes independent rhythmic respiration, and the baby should quickly adapt to the changed environment. Next, why newborn assessment is mandatory? The first thing, to detect the anomalies in the newborn period, all the babies must be examined even if the baby is normal or not. It supports the subsequent assessment of the newborn. Then the assessment must be done in the first 5 minutes. The physical assessment can be done later after stabilization of the newborn, and if the newborn is stable during immediate intrauterine period. So why this newborn assessment is mandatory means we can't suggest whether the baby is free from anomalies or not. So to find out those anomalies, it is necessary to do this newborn assessment. And the second thing, even though if the baby is normal, we have to do this newborn assessment. And frequent assessment or subsequent assessment of the newborn, whether it is needed or not, for that this newborn assessment is helpful. Next, it should be done in the first 5 minutes so that we can identify whether the child is having any congenital anomalies or not, or whether the child is free from high risk and etc. The physical assessment also should be done after stabilization of the newborn. And it is, if the newborn is stable, it may be during the immediate intrauterine period. Next, phase of newborn assessment, where we have to do this newborn assessment. So first we have to pre-warm the room and keep the room temperature between 26 to 28 degrees centigrade to examine the newborn. So this temperature should be maintained during the newborn assessment in the room. Diligent hand washing is essential before initiating the newborn assessment, because without hand washing, it will lead to cross infection. Next, the newborn should be at rest on a flat surface. We have to keep the baby on a flat surface. Next, keep all the materials near to the warmer or incubator to avoid waste of time in between examination. So before doing whatever procedures we are doing, the first and foremost thing is we have to arrange all the articles nearby the area so that it will be avoid waste of time during the examination. So for this newborn assessment, we have to keep all the materials near to the warmer or incubator. Next thing is expose the area that is only required as the baby may go in for hypothermia quickly. So why means during the birth, we have to maintain the room temperature because the thermoregulation process is immature for the newborn baby. So we should not expose all the area of the baby. So we have to expose only the area where the assessment is required so that it will prevent hypothermia. Next, guidelines for newborn assessment. Provide a normothermic and non-stimulating examination area. So the area should be normal temperature and it should be non-stimulating examination area. Okay. Next, keep all the articles in a place of easy accessibility. We have to keep all the articles nearby the examination area. Next, expose only the body or that is to be examined to prevent heat loss. Next, proceed in the orderly sequence except in certain situations. So if the baby is not comfortable during that time, we can skip the sequence or else we have to proceed the sequence. Next, observe the infant's attitude and position of flexion first to avoid unnecessary disturbances. So we have to observe the baby's attitude and how the baby is behaving, which position the baby is maintaining, either the baby is maintaining in a flex position or extended position. So everything we have to observe so that we can avoid unnecessary disturbances. Next thing, perform quiet procedure first, namely auscultation of heart, lungs and abdomen. Next, we have to perform the disturbing procedure at last. Measure head circumference and length at the same time to note the differences. Next, proceed quickly to prevent unwanted stress on the newborn. Next, assessment of maternal history. The nurse need to focus on, before the actual newborn assessment, the important maternal and perinatal history should be reviewed. So the maternal history includes age, parity, medical disorder of the mother. So the age of the mother should be noted and which parity. Then if the mother is having any medical disorder during her pregnancy, these things we have to ask. Next, pregnancy problems, namely present and past drugs. Then IUFD, that means intrauterine fetal death, preeclampsia, intrauterine growth retardation, and prematurity. Whether the mother faced these abnormalities or these disorders during her present pregnancy or past pregnancy, that history should be collected. Next, regarding labor and delivery history, it includes duration, anesthesia, then duration of premature rupture of membrane and APGAR score. These details should be gathered. Then the gestational age of the mother need to be assessed. Next, mother's obstetrical history. The nurse need to focus on the type of marriage, whether it is consanguineous marriage or not, that history should be collected. Next, maternal RH factor, antenatal visit done as advised, then maternal immunization, whether the mother has taken all the vaccines or not, then date and time of admission, then date and time of delivery. These things should be gathered. And if the delivery is term, preterm or post-term, type of delivery, then phase of delivery, rupture of membrane, duration of the delivery conducted by whom, then sex of the newborn, birth weight. These things also need to be collected. Next, the newborn needs thorough and skilled observation to ensure a satisfactory adjustment to extrauterine life. So the physical assessment after birth of newborn is divided into 5 transitional phases. The first one is initial assessment, which includes the APGAR scoring system. Second, assessment of gestational age of the neonate. Third, systematic newborn physical assessment. Transitional assessment focus on the period of reactivity. And the last one is assessment of behavior. So these were the 5 transitional phases of newborn assessment. So first is initial assessment. Common method to assess the newborn's immediate adjustment to extrauterine life is the APGAR scoring system. The criteria to assess the APGAR score in newborn are heart rate, respiratory effort, muscle tone, reflex irritability, and color. So, based on these 5 criteria, the APGAR score is done for the newborn. The immediate assessment of newborn must be at 1 minute and 5 minutes after birth and repeated until the infant's condition stabilizes. Initial assessment scoring system. So A for activity, if it is absent, 0 score will be given. And if the arms and legs are flexed, 1 score should be given. And if the baby is active, score 2 will be given. And P stands for pulse. And if the pulse is absent, scoring is 0. Below 100 beats per minute, then the scoring is 1. And if the baby is having above 100 beats per minute, then we can give score 2. Next, G for grimace or reflex irritability. If the baby is floppy, 0. Then if the baby had minimal response to stimulation, then the scoring is 1. And prompt response to stimulation means we can give score 2. Then A for appearance, that is skin color. If the skin is blue and pale in color, then the score is 0. And if the baby's body is pink and blue extremities are present for the baby, then we can give score 1. And if the baby is pink in color, the score is 2. Next, R for respiration. If the baby had no respiration, then score 0. And if the baby had slow and irregular respiratory pattern, then score is 1. And if the baby had vigorous cry, then the score is 2. So in this picture, you can see the scoring system. So just go through it. So if the interpretation is if the baby had 0 to 3, score means severely depressed. And if the score is between 4 to 6, moderately depressed. And if the score is between 7 to 10, then the baby is in excellent condition. Next, the APGAR score is affected by the degree of physiological immaturity, then infection, congenital malformation, maternal sedation or analgesia, neuromuscular disorders. So if the baby has these conditions or disorders, then the APGAR score will be affected. So cumulative scoring of APGAR score 0 to 3 signifies severe distress, 4 to 6 represents moderate difficulty, and 7 to 10 indicates absence of difficulty in adjusting to extrauterine life. Next, moving on to clinical assessment of gestational age. Assessment of gestational age will help to reduce perinatal mortality and morbidity rate. The gestational age is determined by new Ballard scale, that means NBS. For infants with gestational age of at least 26 weeks, the examination may be performed up to 96 hours after birth. The initial NBS assessment must be done within first 48 hours of life. So note, antenatal means it covers the time from conception until birth. Antenatal means it covers the time from conception until birth. Postnatal, it means first 6 weeks after giving birth. Next, the perinatal period, the time period starting at 22 completed weeks gestation and lasting through 7 days after birth. And next is intranatal, during or at the time of birth. So I hope you all know the difference of these four terminologies. Once again, I will repeat, antenatal, it covers the time from conception until birth, and the postnatal period, first 6 weeks after giving birth, and perinatal period, the time period starting at 22 completed weeks gestation and lasting through 7 days after birth, and intranatal, during or at the time of birth. Next, estimation of gestational age by maturity rating. The criteria under neuromuscular maturity focus on posture, square window, that means angle at rest, arm recoil, popliteal angle, scarf sign, heel to ear sign. The physical maturity is assessed by skin, lanugo, plantar surface, breast, eye and ear, genitalia of male and female. In the new Ballard score scale, the gestational age is estimated based on neuromuscular and physical maturity. So let's see one by one. The estimation of gestational age by maturity rating. First one, neuromuscular maturity. In that, the first is posture. We all know the normal term baby, they will be maintaining flexed position. So assess the posture for the degree of flexion of extremities. At term, a newborn's legs and arms are moderately flexed at rest. Preterm newborns show lesser degree of flexion. The younger the gestational age, the less flexion the newborn demonstrates. So the posture is, for term babies, they will be maintaining flexed position, and for the preterm babies, they will be maintaining extended posture. Next is square window. Assess square window by grasping the newborn's forearm and gently flexing the wrist towards the inner arm. Do not allow rotation of the wrist. Measure the angle that forms where the hand meets the wrist. At term, the hand should touch the wrist, resulting in a 0-degree angle. Preterm newborns show greater angles of flexion at the wrist. The younger the gestational age, the less flexibility at the wrist. Very preterm newborns have an angle of wrist flexion of 90 degrees or more. So, in square window, if the baby is having 0-degree angle means then the baby is term. And if they are having greater angles of flexion at the wrist means preterm. And if the flexion of 90 degrees or more, then it indicates very preterm. So in this picture, you can see how we have to assess the square window. So here, this angle will be measured. So if this angle is 0-degree, then it is term. And if it is less than 90-degree angle, then the baby is preterm. And if it is more than 90-degree means very preterm newborn. Next is arm recoil. Measure arm recoil by first flexing and holding both forearms for 5 seconds. Then extending the arms and hands fully at the newborn side. Next, release the hands and allow the arms to recoil. And the baby, if the baby's term means return to flexion. Term newborns demonstrate full recoil to a position of flexion, while preterm newborns show less flexion. Measure the angle of flexion at the elbow to determine the arm recoil score. Next is popliteal angle. Here, with the newborn's thigh pressed against his abdomen, measure the popliteal angle by moving the foot gently towards the head until you meet resistance. At this point, measure the angle behind the knee in the popliteal area. Term newborns are less flexible with about a 90-degree angle. With very preterm newborns, the leg straightens to 180-degree angle. Next is scarf sign. Assess the scarf sign by grasping the newborn's hand and attempting to cross the arm over his body at the neck. The arms of term newborns meet resistance before crossing midline, while preterm newborns cross the elbow past midline. So here term babies means they will feel resistance and they can't cross the midline. But the preterm babies, they will be crossing the midline. Next is heel to ear. Assess heel to ear by raising the newborn's heel towards his head in an attempt to bring the foot to the ear. Do not raise the newborn's buttocks off of the examination surface. Stop when you meet resistance and measure the degree of extension of the leg. With preterm newborns, you will come close to touching the heel to the ear, while you will meet resistance almost immediately with term newborns. So, for preterm newborns, we can touch the heel to the ear, but in cases of term newborns, we will feel resistance. So here you can see the scoring. So based on the picture, we have to give the scoring to the baby. So here you can see posture, square window, arm recoil, popliteal angle, scarf sign, and heel to ear manual. And its scoring. Next is physical maturity. So here skin, if the skin is sticky, friable and transparent, then scoring -1. If the skin is gelatinous, red and translucent, score 0. If the skin is smooth, pink in color and visible veins, score 1. And if the skin has superficial peeling or rashes and few veins are visible, means score 2. Cracking pale areas and rare veins means score 3. Parchment, deep cracking and no blood vessels visible means score 4. Leathery, cracked and wrinkled skin means score 5. Then lanugo, absence of lanugo -1. Sparse, score 0. Abundant 1. Thinning, score 2. Bald areas 3. Mostly bald, score 4. Next, plantar surface, if heel to toe, 40 to 50 mm -1 or less than 40 mm -2, then the score is -1. And if no creases are there, means 0. Faint red marks is present, score 1. Anterior transverse crease only present, then score 2. Creases anterior two-third area present means then 3. Creases over entire sole means score 4. Next, the breast imperceptible -1, barely perceptible 0, flat areola and no buds means score 1, stippled areola 1 to 2 mm buds means score 2, then raised areola and the bud is 3 to 4 mm then score 3, full areola and 5 to 10 mm bud means score 4. Next, eye and ears. Lids fused loosely -1 and tightly -2, then -1 score. Lids open, pinna flat and stays folded, score 0. Slightly curved pinna, soft and slow recoil means score 1. Well curved pinna, soft but ready recoil, then score 2. And it was well formed and firm instant recoil is there, score 3. Thick cartilage and the ears are stiff means score 4. Genitalia for male, scrotum flat smooth -1, scrotum empty faint rage then 0, testis in upper canal rare rage then 1, testis descending few rage then 2, testis down good rage 3, testis pendulous and deep rage 4. Genitalia of female, clitoris prominent, labia flat -1, prominent clitoris, small labia minora score 0, prominent clitoris enlarging minora 1, majora and minora equally prominent score 2, majora large and minora small 3, majora cover clitoris and minora then score 4. Maturity rating score you can see according to the gestational weeks on the right side of the picture. So next is intrauterine growth curve. The intrauterine growth curve are used to classify infants according to birth weight and gestational age. The infant's birth weight, length, and head circumference are plotted on standardized graphs that identify normal values for gestational age. If the infant's weight is between the 10th and 90th percentile or presumed to have grown at normal rate regardless of the time of birth, they are called as appropriate for gestational age. Infants who are above 90th percentile can be presumed to have grown at an accelerated rate during fetal life. They are called as large for gestational age. And if the infants who are below 10th percentile can be assumed to have intrauterine growth retardation or delayed or called small for gestational age. So next is physical assessment. For physical assessment, stay tuned for the second part of this newborn assessment. These things I have referred the content from Tamil Nadu Nursing Midwife Council online CNE courses. So, and I have referred from website. So I hope this video is very useful for you. So till now, who didn't subscribe to my channel, kindly subscribe, like, share and comment. So stay tuned for the next part of this newborn assessment. Until then, bye-bye. It's yours, Angel. Thank you.